I'm Charles Kanos. I'm a Southeastern Neurosurgical. I've been there for 11 years. We're employees of Greenville Memorial Hospital and run a practice across the street from the hospital. We get patients from all over the upstate. Our practice has interest in the full range of neurosurgery, from the most minimally invasive to the most complex. In medical school, you're exposed to a whole lot of different parts of the human body. I immediately was attracted to the nervous system. The brain was the coolest thing I'd ever seen. And the more I studied it, the cooler it got. And I was fortunate enough to get a spot in neurosurgery and take it from there. The specialty of neurosurgery encompasses brain surgery, spine surgery, and peripheral nerves. Specifically, any problem with the brain, including trauma, tumor, vascular problems, an assortment of other cranial problems, any spinal problems, spine pain, neurological dysfunction, and peripheral nerves such as severing a nerve in an accident or carpal tunnel syndrome, the full range. I was born in Spartanburg and lived in Gaffney, then moved to Connecticut. I graduated from Duke University and then medical school in my residency and fellowship at the University of Tennessee, and the fellowship in cranial skull-based surgery. And then this is my first and only job is at Greenville. I'm most interested in cranial neurosurgery, specifically skull-base tumors, what those are. Those are some of the more complex tumors at the base of the brain. Acoustic neuroma is one of the more common skull-based tumors, along with pituitary tumors. But I also enjoy the full range of spinal surgery, mainly minimally invasive. Whenever we can do a minimally invasive procedure, that's what I like to do. When a patient comes to our practice, we want them to be assured that we're going to try to be as conservative as possible. We're going to consider all options, and we're going to think about their case and discuss it among our partners and our colleagues to make sure that they're getting the best possible care by the best possible doctors. The volume and the variety of pathology that we see at Greenville Memorial is incredible. It rivals any other hospital around, certainly anyone I've ever been exposed to, and that's definitely a positive. If you're a patient and you come either with the most mundane, simple problem, we've seen it a million times, and if it's a very, very complex case, maybe not a million, but we've seen it a lot, and you definitely want that when you're looking for a doctor. When a patient comes in and we're considering an intervention such as surgery, it's important that they understand the thought process. Why did we reach the conclusion to have surgery? And we thoroughly examine the patient, take a thorough history, and review all studies, and give them the option. And it's important that the patient understands that this surgery is an option, but we want to make sure that they understand that there are potentially other options too, and there are, especially for the spine, that are non-surgical. And we want the patient to understand all of those options. One of the benefits of coming to a practice such as ours, affiliated with a huge medical center and the huge volumes, we have the experience to handle most things, from a basic common medical ailment or neurosurgical problem to the most complex. And I think a patient should, certainly when they're looking for a doctor, they should be very comfortable with that doctor, feel like they've had attention and were examined, and they feel comfortable with decisions that's been made. And you also want the doctor to have the experience to perform what they're proposing, and we feel we have that. I've got a wonderful wife and two beautiful kids, and when I'm not working, I try to spend as much time with them as I can.